Hi guys, welcome back to my YouTube channel. My name is Pharmacist Inyolo Onofowokon, and on this YouTube channel I talk about faith, pharmacogenomics, proper use of medications, for facts with family and every other good stuff. So today I want to tell you about why you should know the proper names of your medications. And when I talk about the proper names of your medication, I mean the generic names of your medication. Take case in point, if you are to use metronidazole, you should know that it is metronidazole, not flagyl, or if it's paracetamol, not drugamol, it's paracetamol. Why you should know the proper names of your medication. So first, know the generic name of your medications, especially if it's a medication that is to be used for long term, for maybe non-communicable diseases like hypertension, diabetes. Then know the reason why you are using this medication. Know what you are using the medications to manage. Know, oh, this is for malaria, this is for hypertension, this is for diabetes. Is proper and good to know. So what are the reasons why should you know the proper names of the medication? For medication history, many times when you go to the hospital, they ask like, what medications have you used before? Why? And they want to know if these medications could have caused the disease, because the medication could cause some symptoms like side effects and all. And they want to just know if you've had any side effect, adverse reaction, or just to just take proper audit of medications that you have taken before. Even in medication reconciliation, when the pharmacist is trying to look at your former drugs, your present drugs, and the drugs you have to be taking going forward, they want to know you to know the proper names of the medication, so that when the physician asks, you know it and they're able to take right decisions going forward. And the second point I mentioned earlier in my first point is side effect and adverse reaction. In case there is any side effects to any drug, or you're feeling any symptom after using any medication, or any adverse reaction after using medication, it will be good when you come to the pharmacist or you go to the physician and you're like, oh, this is the name of the medication I used that caused this. It's after I used this name of the medication that I started feeling like this. It just helps to take proper consideration, proper management of the side effects of the adverse reaction, and helps even in documentation of this adverse reaction. Number three, if you're out of your base, maybe you travel to another place for a visitation, and if these your medications are over the counter medicines, you want to know, you want to go to a community pharmacy and just say, oh, this is what I'm using because it's an over the counter medication. You don't want to have to call your physician again and ask them, oh, what medication am I using? Then human errors, because for many times, especially in this our side, it's humans that dispense. Many times it's human beings that dispense medication. So when your medications are dispensed and you check, oh, this is the name of the medication, and you're like, oh, this is not what I've been given before. This is not what I am used to. This is not what I have taken before. This is not what I normally would use. So that you will, if it's an error, the pharmacist can change it. Or if it's from the physician, the pharmacist can explain to you that, oh, this is what you have to be using taking forward. And that is why I am saying know the generic name, not the brand name. So that it's not be that, oh, you are speaking over brand names or different brands. Just knowing the generic name will help you. Oh, they are giving atorvastatin, and you know you don't use atorvastatin, maybe you use rosuvastatin, and you can complain, oh, this is atorvastatin. Why am I being given atorvastatin this time around? If it's an error, it will be corrected. And if it's just a change of medication, you will know. And another thing, the final point I want to mention, why you know the name of your medication is that to just help you to be calm and to be adherent. If you are given another brand name or a tablet that has another shape or another color. Currently, in the hospital I work, we got a new brand of paracetamol that is orange in color. Now imagine many patients are used to white paracetamol and everything. But knowing that, oh, this is paracetamol, this is the name of the drug paracetamol, that means it's paracetamol that is there, it just makes a patient feel safe and adherent to the medication. So I employ you. There are many ways to learn the names of the medication. You can type them. Ask the pharmacist what is the name of the medication. They will tell you what am I using it for. Tell you. You can write it down, document it on your phone, take pictures. Many ways to just know the name. If you cannot memorize it, you can write it down in your phone, save it somewhere, send it to family member that can remind you, and all of those good stuff. Thank you for watching to the end. And if you are yet to subscribe to my YouTube channel, what are you waiting for? Subscribe to my YouTube channel. See you in my next video. Bye for now.